All right, good evening. We have 12 attendees. We'll give everyone a few minutes to get started. If you want, or in a place with a webcam, please present yourself so we can, yay. We'll get started in just 1 minute. I'm not seeing anyone but Nayan and Dr. Jain. Maybe people are shy. All right, everyone. We'll get started. It's 5:01. We've got 14 people on the line and expect a few more. So I'm Melody. I'm a fellow for life from Chicago, 2012 to 2013. I'm currently living in the San Francisco Bay Area, involved in the program here, and want to welcome you to our second webinar of a series that has been launched by Fellows for Life. And the goal is to provide ongoing learning opportunities for our community and to reconnect. Sorry about the sirens. And this came out of the Leadership Summit in Tulsa. So today we have over 50 Fellows for Life signed up from Alabama, Boston, Chicago, Detroit, Dallas, Houston, LA, Lamborghini, SF Bay Area, Tulsa. And we also have some Fellows for Life who are living in Portland, Maine, Baltimore, Atlanta, Cincinnati, and Seattle. And Dr. Jain is in Southern California. We're so honored to have you on tonight. He's the CEO of CareMore Health and a Boston graduate of 2003 to 2004. So we have 15 minutes for the presentation, and then Dr. Jain would like to spend 15 minutes with us for Q&A. So at the end, we will open it up for questions.
Yeah, it's really great to be here. I want to thank you all for hosting me today, and I want to apologize. I thought we were going to have some slides, but we produced them a little bit late, and they are full of technical glitches, so I apologize for that. So I thought I would just kind of keep it informal since, you know, this is a community that's near and dear to me. I was a fellow, as Melody said, from 2002 to 2004, or 2003 to 2004. My project at the time focused on healthcare for the homeless. I had started a healthcare clinic for homeless patients in Harvard Square, at the Harvard Square Homeless Shelter, which was a shelter that I had volunteered at when I was an undergraduate student. It was really an extraordinary experience for me, in part because I think got to work with a population that was truly worthy, but it was also, I think, a really remarkable experience because I enjoyed, I think, the fellowship and the people that I got to know and maintain friendships with and relationships with. And so I really, appreciate the opportunity to continue to be a part of this community and stay connected. I'm also not the only Sachin Jain in the fellowship. Unbeknownst to me, there was another Albert Schweitzer Sachin Jain fellow around the same time in Chicago, and we've now crossed paths several times. And so I have the honor of being one of two Sachin Jains in the Albert Schweitzer Fellowship. Who knows? Maybe there are more. I wanted to spend a little bit of time today talking about our work to address loneliness in the senior population. Personally, I'm very passionate about this topic, in part because I think a lot of my lifetime's work has really been about connecting people and bringing people together who otherwise had not come together. And I think I participated in another fellowship that I would recommend very strongly to all of you, which is the Aspen Health Innovators Fellowship, which gave me, I think, some focused time over the last couple of years to think hard about what was important to me. And I think one of the topics that I realized was very elemental and very fundamental to me is bringing people together. And I realized that the healthcare system over really, kind of the last several decades has missed an important opportunity to actually create social capital, to bring patients together, and also to address, I think, a lack of social connection that many people feel in their later years of life. The organization I lead, CareMore Health, is a 25-year-old organization that kind of grew up in the senior care space, but now we work with multiple different types of frail and vulnerable populations. And, I have the privilege of leading CareMore as well as working as a physician at CareMore. And when you work with patients in this organization, most of whom are seniors, what you quickly realize is that in addition to all of their medical problems, there's a host of social problems that oftentimes get under-recognized and underappreciated by the healthcare system, and loneliness is one of them. And I think there's been this now industry. We're using tons of industry jargon around social determinants of health, but and many organizations are launching initiatives in social determinants of health. But the reality is that what we're really talking about are just basic social problems that I think go unaddressed or unrecognized by the healthcare system. And I think there's this extraordinary opportunity for all of us to think differently about how our organizations impact basic human needs like human connection and social connection. And about 2.5 years ago, we decided we would launch, as an outgrowth of my work in the Aspen Health Innovators Fellowship, I decided I would launch at CareMore what is really the first clinical program in the world that's focused on screening and identifying lonely patients, and then working to help prompt and create connection for them. And we use our kind of annual wellness visits, what we call our Healthy Start visits, to screen patients for loneliness. We also do direct marketing to patients so that they can self-identify themselves as being lonely or socially isolated. And then we also ask clinicians working within CareMore to identify patients who might benefit from the intervention, benefit from additional connection or social connection. And the intervention that we launched is quite simple. It's got 3 arms to it. One is a weekly phone call from someone who's either a professional staff or a volunteer who's interested in connecting with a lonely senior. The second arm of the intervention is home visits for people who have unmet needs at home that can be addressed by a home visit. And then the third is really kind of referral and encouragement to participate in social programming that we have at our care centers that also have senior-focused gyms attached to them. And so there's an exercise element to it, but there's also a social element to it within our senior-focused gyms. And we've, when we started on this journey, I really kind of wondered this question, like how valuable or how important would a weekly phone call be to a lonely senior? And 2 weeks ago we celebrated the 2-year anniversary of the program, and we invited 60 program participants to visit with us at CareMore. All of them came, and all of them, I think, spent hours kind of testifying about the value of these weekly phone calls for them. And what was most striking and really just, I think, remarkable about these phone calls was that what we learned is that there's so many people for whom this was their only regular point of contact. And I think that was a pretty striking realization for us, that there are so many people, who have aged into a period in their lives where they don't have friends, they've outlived their children, where they may have lost contact for a variety of reasons with people, in their lives, and now find themselves in a place where a weekly connection point with their healthcare organization actually, is really meaningful to them. And that was something that I couldn't have anticipated when we started down this journey. I really kind of wanted to just get closer to lonely patients and understand, what needs we might be able to fulfill for them. And, the reality is that even a weekly phone call is valuable to patients. What I love about this problem is that it's not a problem that requires us to invent a new drug. It doesn't require us to invent a new medical procedure. It doesn't require, anything that we don't already have access to. It just requires us to, number one, accept that this is a problem. Number two, decide that we're going to actually solve it. And then number three, build some just basic programming like a weekly phone call. And, what I would argue is that every one of you, this is the type of problem where every one of you now has the potential to either for a lonely senior in your life or, through the organizations in which you work, decide that you're going to address this issue. And there's very few, I think, problems like that are actually are very kind of require very few resources to address, very few resources to solve. And it's just been this really remarkable adventure and journey. The program has had this organic scaling that has happened. I think, CareMore is a division of Anthem, which is, the largest health insurance company by membership in the country, and second largest rather. And we've had this ability now to scale this program beyond just CareMore patients, but also a broader group of Anthem, Medicare seniors. And, really people all over the country are now getting phone calls that they didn't previously get. They're getting encouraged to participate in social, interaction. And what's been, I think, exciting for us is we're starting to see that this is resulting in a change in people's health behaviors. Some of the conversations that we're having with people are about participation in preventative care services, and we're seeing that people are getting their preventative screenings more often. We're seeing that people are engaging in their health more regularly, and we're actually starting to see some evidence of a decline in hospital readmissions and admission rates. And so we're starting to see that this is a program that has benefits in terms of healthcare utilization for patients. So one kind of interesting cautionary note about this is that I think the program suffers a lot from the usual, I think, frailties of pen pal programs, which is that a lot of people get excited about doing this work because they have a mental image of what it's going to be like to outreach to a lonely senior, which is that, they imagine some version of like Tuesdays with Morrie, where they're having a weekly interaction with a lonely senior that they are that they're excited to connect with, and then they realize that these conversations are actually oftentimes a lot harder than they might have imagined. Seniors are oftentimes challenging. Lonely seniors in particular are oftentimes oftentimes challenging to have conversations with. They sometimes are perseverative, sometimes are obsessive around a certain set of topics. And, a lot of the work of interfacing with these folks is working through that with people, talking with them, engaging with them in kind of this deeper way that I think, is oftentimes not as easy as people think it is. And so, we went through a period where we were using a lot of volunteers to reach out to these lonely seniors. We've now, I think, use a hybrid of volunteers as well as professional staff whose full-time job it is to do this kind of work. Because, an unintended consequence or a potential unintended consequence is raising the expectation of a senior who, but then letting them down by not actually, kind of completing the sequence of follow-up interactions and follow-up phone calls. One of the important elements of this that I think is an important story is that we're a fully at-risk healthcare organization, meaning that we're fully at risk for all of the healthcare expenses associated with the care of the seniors that we take care of. And so, we're able to do this because we are able to invest in in things that will make a difference for our patients or that we believe will make a difference for patients. This is not a fee-for-service healthcare system for those of you who are kind of familiar with healthcare financing. And so as a result, I think when you guys think about how you can do this in your own environment, a lot of how we're able to do this is because our business model enables it, meaning we are, again, fully at risk for all the medical expenses for our patients. And so we have an opportunity to make strategic investments where we think it's going to translate into better health for our patients. The journey to this program has been an exciting one. We've now touched over 1,000 patients. We've made literally thousands of referrals to community-based resources. And, we have patients and members who are just really moved by this. And, personally, it's been the thing that I've been most proud of in my career. I've done a lot of cool and interesting things. I worked in healthcare reform in the Obama administration. I've, had the opportunity to launch the digital health group at Merck. But what I would say is this, for me, has been the most personally meaningful thing that I've done. I think, in part because it just wasn't something that people had done before, and in part because of the difference that we've started to make in people's lives that really just feels really, really good. So, I'm happy to talk about, in the Q&A portion of our time together, I'm happy to talk about this program. I'm also just happy to talk more generally about careers and lessons learned, or whatever is useful to all of you. I'm just thrilled to be able to be with you today, and very humbled to be part of this community.
Thank you, Dr. Jain. I'm going to turn it over to Nyan to facilitate some questions. We'll open up to the audience. If you want to type in your question, we can unmute you to ask the question, or you can type it into the chat box. So I'll start with one, Dr. Jain. It's Melody, just to keep us moving. What does it mean to you to be a fellow for life? And kind of when we spoke last week, you were excited to hear how we're kind of getting reconnected and to be a part of this webinar series. Is there something that you would like to see happen across our network of 4,000, or maybe speak to how the Fellows for Life, what does that mean to you, and what do you see for the future?
Yeah, I mean, there's almost like a good housekeeping seal of approval when somebody's an Albert Schweitzer Fellow, right? You know that they're kind of interested in the same things and kind of are approaching work with the same set of values. And so, I mean, I think there's a number of ways in which this community can be really supportive of each other. One of them is kind of unlocking career opportunities for people. We're constantly growing as an organization, and I'm always looking to connect with talent that actually has the types of values that are, I think implicit in an Albert Schweitzer Fellow. And so I think, I think unlocking career opportunities for each other is one, I think, real easy thing we can do for each other. I think the other is, one thing you realize when you're kind of geographically mobile and you're moving to new cities is that, you have all these affiliations that we all have. We all went to certain colleges, we went to certain schools, we grew up in certain communities. Being a part of a fellowship like this, I think, could really be powerful if there was an inbuilt set of, inbuilt community where people could just kind of seamlessly move to a new city and, be welcomed into a community of like-minded fellows. I've had the experience over the last couple of years of moving from Boston to DC to back to Boston, now to LA, and we've set up, CareMore shop in 10 new states in the last 4 years. I think being able to kind of, join in socially or connect in with a community of people who, again, are like-minded in all of these places, I think is a really remarkable opportunity for all of us to create for each other. And so I think there is this next phase of evolution for the community, which is a more social one, which I think will naturally translate into, professional growth and support for each other.
Yeah, we're hearing that a lot from fellows and that was certainly part of my story moving from Chicago to San Francisco. I said, is there a Bay Area program? And it turned out there was. And so I've been reconnected with a couple of fellows in the Bay Area, and it's just been awesome. And some from LA. So yeah,
great.
That's great. Another question. I'm not seeing any in the chat, so Nyan, just let me know if.
Yeah, I have one from Lachlan. He says, Sachin, thank you so much for joining us. Can you comment a little more on how we in the Schweitzer Fellows programs and health professional schools more generally can deepen skilled and satisfying work with underserved communities?
Can be.
So,
I missed the last part. Can be more.
Deepen our skills
can deepen skills with underserved communities.
after the fellowship?
Sorry. Can you comment a little more on how we in the Schweitzer Fellows programs and health professional schools more generally can deepen skilled and satisfying work with underserved communities?
Can deepen skills. Got it. You know, I think a lot of it is has got to be experiential. I mean, the reality is that working with underserved communities, you know, for a lot of people, I think is uncomfortable. You know, let's just call a spade a spade. I think a lot of people have very good intentions to want to work in underserved communities, but there is a fear factor of not necessarily knowing what you don't know. There's a fear of being, you know, unsafe. There's a fear of kind of encountering things that feel uncomfortable to you. And so I think, you know, the extent to which we, you know, the fellowship and health professional schools can curate experiences that are really high quality, that, you know, where people can, number one, feel safe, secure, get exposed to things in a stepwise way, but then also have a, you know, a reliably good experience. I think, you know, we'll get people more comfortable with doing this kind of work. I think, you know, my work in the fellowship, you know, many moons ago, and the work preceding the fellowship, you know, working with the homeless community, again, I think generated what I would say is like a lifetime fearlessness around working with that community, because a lot of your preconceived notions and stereotypes about that community are proved wrong. And I think we don't have enough honest conversations about that. I think in our outrage culture, I think we sometimes snap at people for actually, you know, saying the honest truth, which is that they're uncomfortable with certain things. And I think we need to create a safe space for people to not only voice some of those anxieties, but then also help them through them. And so I think that's a huge opportunity for the fellowship to get a broader group of people comfortable working in underserved communities and with underserved populations.
Thank you for that. I have a comment from Emily Hendel. She says, we ask on our SDH questionnaire about the need for opportunities for social engagement, and it's always tied with the need for food resources and the most needed resource among the patients at our free clinic in Chicago. Emily, did you want to be unmuted to kind of speak more on that? I just unmuted you.
Hi.
Hi.
Yeah, I found what you were sharing really interesting, and it made me think about the fact that, you know, we just in the last year started, I work at a free clinic for people who are uninsured and low income in Chicago, and we just in the last year started doing a social determinants of health questionnaire, and one of the things we ask about is need for opportunities for social engagement. And we kind of expected food to be high on the list of things that people express need for, and help with housing. We really didn't expect, you know, food and opportunities for social engagement to really jockey for that first position. It sort of goes back and forth, and it just really surprised us. And it made me think of that, you know, our experience when you were talking about what an impact that, you know, just sort of engaging with people who might be lonely can have on their health. It just made me think of that.
Yeah, no, it's a great, you know, thank you for the comment. I think we're, if you haven't read Bowling Alone, I think it's more relevant than ever. It was Bob Putnam's book from 2001, and one of the kind of seminal works that got me interested in this topic. You know, the book is about the decline in social capital in America and the changing nature of kind of social bonds and connections. And, you know, we have been in a steady and continuous decline in the amount of social capital that we have in our country. And, you know, I think the best way to kind of ask the question is, like, how many of you actually know your neighbors to the right of you and to the left of you, know their first and last names? You know, most of us don't. I can say I moved into a new community about a year ago, and I don't know most of my neighbors, and that's a function of changes in our lifestyle, changes in communities. There's all kinds of factors that are associated with it. But at the end of the day, I think more and more of us are feeling more and more disconnected from each other, and it's one of those things that people feel uncomfortable saying out loud for fear of being labeled with whatever label you would attach someone to like that. But at the end of the day, social connection is the most human thing that it's what almost defines being human. And so I think we need to acknowledge that and honor that a little bit more, and also recognize that we're in a place where social connection is a bit in crisis, where people are feeling more and more isolated from one another and more and more disconnected. And so I do think that there is this great opportunity for all of us to do like little things in all of our little pockets of the world. CareMore is just a relatively small organization in the grand scheme of organizations doing this type of work, that with the potential to do this kind of work. But I think every one of you could start a program within your employer or community to address this issue. And again, it doesn't cost anything. It really just requires kind of a dedication of will and skill and commitment to doing this, which is one of the reasons I love this problem, because I think most people who are trying to solve a big social problem eventually get to a place where they have their hand out, and where they're asking someone who was involved in creating the problem to write a check to address the problem that they helped create. The neat thing about this problem is that no one's asking anyone for a check, and we get to basically solve it if we want to solve it. Just go home and call your grandmother tonight, and you can be part of solving this problem. So I think that's the exciting thing about this area.
Thank you, Dr. Jain. I have another question from Patrick. So Patrick, I'm going to unmute you so you have the option to unmute yourself, but I'm going to ask his first question, which was, do you think your program can be replicated with other seniors who want to volunteer to make those calls, especially if they are trained in mental health first aid? He also asked, what does the screener look like and who implements it?
So I missed the first part of the question. What does the screener look like?
Yeah, so the first question was, do you think your program could be replicated with other seniors who want to volunteer to make these calls, especially if they are trained in mental health first aid?
Totally.
So
I think the issue of like seniors helping seniors is a big one, and I think there is a lot of untapped potential as far, I think in our case we work with our employees largely because it limits our liability, because that is a consideration, kind of working from the perch that we work from. But I do think that there volunteer organizations could easily get seniors working on this. Sorry, second question.
He says, he asks, what does the screener for loneliness look like and who implements it?
Yeah, so there's a UCLA screening tool. It's just a couple of questions and nurse practitioners in our clinics will ask a series of very short questions that then help identify who's lonely. And so we've implemented that tool, and it's freely available online. You can look it up, and it's just a few questions. So and it's nurse practitioners who are kind of doing these annual wellness visits for our patients in our clinics across the country.
Okay. We have a question from Yasmin. Yasmin asks, she says, thank you, Dr. Jain. Can you talk a little bit more about the home visits with patients and how those are structured? Also, how do you structure those conversations? Are they typically guided by the topics patients want to talk about?
It's great questions. So, the home visits are really oriented around, around if we're able to solve a particular problem for them. So if a member says, or a patient says, we've got, I'm worried about fall risk, then we will kind of do a home assessment for that patient. Or if a patient says, that they have, if after some time, with the telephonic interaction, the patient says that they'd like to meet, we allow our staff to do those visits. There's not a lot of formal structure to it. It's more, kind of think about it like a basic social work visit. That's, we have a chief togetherness officer who's a social worker, and she kind of guides that program. What was the second part of the question?
Oh, I'm sorry. Let me see here. The second part of the question was.
Oh, how do we structure the conversations? So
Yes.
So we have some training tools that we've built that are very basic around, you know, kind of open-ended, kind of asking seniors open-ended questions to kind of have them open up. And so I'm happy to share that with you if you're interested. You can just email me. It's just sachin.jain@caremore.com.
Fantastic. So the next question is from Ray. She's in Tulsa. She says, it's evident in some of your work that you've carried some of the passions that help shape your Schweitzer Fellowship throughout your career. What advice do you have for fellows and fellows for life, many of which are at the beginning of their careers, to continue to carry their passion for addressing health disparities out in the real world?
Yeah, I mean, I think I would say really choose very wisely about, you know, sort of where you spend your time and who you work with. You know, a lot of times early in your career, you get a lot of pressure to like stick with things that you know, to demonstrate longevity and the fact that you can stay with something. I think there's some value in that advice. But I also think it's really important to work with people who share values with you and to make sure you're not, you know, kind of working in a place that makes you compromise some of who you are. And I think a lot of, you know, the ethical erosion that happens to people over time is because they work in environments where their values aren't honored, where, you know, the culture doesn't support you in always doing the right thing. And, you know, you'll ask, you know, the next follow-up question may be like, how do you know you're in a culture like that? You know, when you know, you know. You know when you're in an organization that is really about the right things. And I've spent periods of my career in places that weren't about the right things, and you know it, and then you know you got to get out. And you need to, again, align with places that actually have your values. And, you know, I think that is what it's really all about, is like the best way to kind of hold on to yourself is to make sure you're not in places that don't actually make you compromise who you are. And I think that goes against the grain of a lot of career advice, which is about fitting in and learning how to play the game. And but at the end of the day, you know, what I think makes Schweitzer Fellows exceptional is there is this higher level of commitment to values, and why fit in when you can stand out is kind of my advice to you. And I think trying to always be in a place where you know, your values are honored is really important. I think the hard part about that is you may need to move sometimes, and you may have disruptions in your career at times. And that's like the untold career mentorship story that I think you don't get from people's bios, because people's bios always seem like they're stepwise progressions, you know, towards something grand and great. And I would just, you know, encourage you to just make sure you're not compromising and that you are true to yourself. Because if you're not, you know, you'll give away a piece of yourself. And I think that's one of the most concerning things about, I think, the modern American workplace is there's this push to conform instead of to actually get the best from everyone.
Thank you. So we have another question from Jahangir Khan. The question is, what makes CareMore's association with Anthem unique, and how did this partnership come about?
It's not really a partnership. We're a wholly owned division. We were acquired in 2011. But I think one of the things my predecessor, Liba Lesson, did really, really well is I think she recognized the culture, you know, in sort of telling the story of the company and kind of building the company. It was the culture that I think made it special. You know, lots of organizations do this kind of work, but I think the fact that we are so unapologetically patient-centered is, I think, what makes us really unique. And when you build a culture around that, you know, it's very hard. You know, culture lasts far longer than the leaders who actually built the culture. And so, you know, even though we were acquired by a large publicly traded company, you know, almost 8 years ago now, I think we've been able to hold on to a commitment to always do what's right for the patient, no matter what. And I think that's something that, you know, is unique. And if you're in an environment like that, you know, it's very special. And I hope you get to work in places like that, and hope some of you will come to CareMore.
Thank you. So Dr. Jain, do you have more time? We have another question, and then I think Melody has a closing question for you.
Happy to take those two questions. Yeah, absolutely.
Okay. So Stephanie Lomez Neiman, thank you for your question, Stephanie. She writes, thank you, Dr. Jain, for speaking about your fellowship experience. Question, elders who are screened for loneliness, can you tell a little bit more about the process of how an elder person is connected with someone that calls them on a weekly basis? Is the elder person matched to the volunteer or vice versa? So that was her question.
Yeah, so I wish we were more scientific. We're not. When we started the program, we wrote a letter to all of our 85,000 seniors, and we asked them to self-identify whether they were, lonely or socially isolated. We got several hundred letters back from people or calls back from people saying that they wanted to be part of this program. The wording of that letter was really important because you don't want to make people feel worse about, kind of their lack of social connection. So we spent a lot of time writing that letter. And then, there's, the work that we do, within our clinics, which is really around, implementing these UCLA screening questions to ask patients about whether they're lonely or not. The exciting thing about it is, what we find is that even if the match is imperfect, people are still very appreciative of the connection. There are obviously, better and worse matches, but the truth is that if someone's really hungry for connection, a wide range of kind of personalities can actually end up really working well together is something that we've seen. So there's probably opportunities to refine the match over time, but we're still just getting started, to be honest.
Awesome. Let's see here. Melody, do you have any final questions for Dr. Jain?
Yeah, and thank you so much for taking extra time with us. We really appreciate it. And everything you're saying is awesome. Everyone wants to know where the giant like button is and to applaud you. I'm getting all these texts coming through, so it's really great. Something that a lot of us find so wonderful about the Schweitzer Fellowship is the interprofessional nature of it. And I believe that you're a really big proponent and you're passionate about partnering with nurse practitioners and improving joy of work through some of that. Can you share more? And
yeah, our model is
actually ran into a doc that said you saved his life because you brought joy back into his life, and it all had to do with that relationship with the interprofessional team and nurses.
Yeah, I mean, our model is really implicitly interprofessional. I mean, we've got nurse practitioners, social workers, dietitians, exercise therapists, podiatrists, physicians, working all alongside each other in service of our patients, in service of our members. I actually credit the Schweitzer Fellowship. I don't think I would have had as much exposure to the different health professions if I hadn't participated in the Schweitzer Fellowship. I think it's one of the real unique value adds that it's not, kind of all people coming from a single professional line. Because I think what it does is it really exposes you to the different kinds of the diversity and training that really exists across the health professions and the unique things that people bring to the table. I think organizations do a better and worse job of actually valuing different healthcare professionals. And I think one of the worst words that has entered our lexicon in healthcare is the word provider, because I think it strips people of their professional identities that are so hard fought and so hard won. I think we all need to be referred to by the names, by the professional, training that we have. And I think in doing so, it really elevates the professionalism. And I think one of the things we're very passionate about, and it's hard work because I think people are beleaguered, they are burnt out, is trying to, simultaneously kind of balance, I think, what I'll call like the checkbox imperative that has kind of descended upon American healthcare and American medicine, which is like you need to meet all these quality measures, while also kind of not losing the kind of intrinsic human connection that I think brought us all to the health professions in the first place, which is, fundamentally about, connecting with patients and then connecting with other healthcare professionals. I mean, when healthcare is at its best, it's a field that is, intrinsically interprofessional and a lot of fun. And when it's not, kind of at its best, it's when we're kind of practicing in silos and not really engaging with each other and kind of just trying to meet the mail and not really go the extra mile. And so I think, interprofessional work really allows us to go the extra mile because it allows us to bring the skills that each one of us brings uniquely to the care of patients. And I think, again, that is, I hadn't thought about that as a real, I hadn't connected that back to the Schweitzer Fellowship until you asked the question, but I do think that's an incredible value of the fellowship.
Awesome. Thanks a lot. If people want to get in touch with you or are curious about career opportunities at CareMore, are you hiring?
Yeah, anytime. Yeah, LinkedIn, Twitter. My email address is just my first name dot my last name at caremore.com. Happy to engage with any and all of you. So really appreciate it.
Awesome. Thank you so much.
Great. Thank you. Really great to be with all of you.
And
right.
I'll turn it over to Ashley to announce our next quarterly webinar, which obviously you'll be invited, Dr. Jain.
Awesome. Thank you so much.
Okay, have a good night.
Forward to it. Bye-bye.
Bye.
Hello, everyone. Can you hear me?
Yeah.
Okay. My name is Ashley, and I'm a Tulsa Fellow for Life. I work at Oklahoma Policy Institute. I just wanted to quickly announce the next webinar that we are in the works of scheduling. We have Dr. Fernando Poulet from Iora Health, and he's a Fellow for Life that is going to be scheduled for late September. And we'll have more of the exact details on that coming soon, so stay tuned.
Thanks, Ashley.
Thank you.
Okay, so Nyan, my lovely hostess.
I'm here.
Hi. So everyone's muted, right? Do we have time for any debriefing, or I wasn't on the first one, so I just wanted to check back with you if we should call it a wrap, or was there another? We still have a little more time to cover any questions or feedback. Are people typing to you?
No, we don't have any other questions right now. It's 7:41, so if anyone has any other questions about anything Fellows for Life related, please enter them into the box. Otherwise, I think we will wrap up and encourage everyone to definitely stay in touch. If you have any other ideas for future webinars, please let us know. And, we'll take any potential speakers and ideas as we try to do these quarterly to keep us all connected. So. And
another ask I would say is for everyone to, we have a Facebook page, a LinkedIn page, but we're still trying to locate some of our potentially missing Fellows for Life. So if you think of folks or you come across them, make sure that they're connected to our community as we move forward with this work. And we'll see you soon.
Thank you all so much.
And thanks to Maya and Rachel for setting up the tech and everything. We really couldn't have done it without the team. And thanks to Tulsa for the enthusiasm. All right, good night.
Good night, guys.